Okay, I think we got everyone. All right, good morning, everyone. Welcome to City Hall. Thank you for being part of our update this morning on the efforts centered around alleviating the humanitarian crisis at Mass Ave and Melnia-Cass Boulevard and throughout the city. I am here with many key leaders who have been working day and night to ensure that all of our efforts are coordinated on this front, some of whom you will be hearing from later. Dr. Monica Burrell, Senior Advisor and really running point on these issues. Sheila Dillon, our Chief of Housing. Dr. Basola Ojikutu, Executive Director of the Boston Public Health Commission. Superintendent Gerard Bailey of the Boston Police Department. Lieutenant Peter Messina of the Street Outreach Team with the BPD, also joined on his first day by Officer Peter Mascrotolo from BPD as well. Thank you for your efforts. Our Chief of Streets, Yasha Franklin Hodge, who will be discussing our public works efforts. And thank you to Mike Browell, who isn't here today but has been very involved and ran a wonderful first snowstorm. Thank you. And of course, our Fire Commissioner, Chief Jack Dempsey. So I just want to give a brief summary of where we've been, as well as where we're headed this next couple days into this week and beyond. So just to start with the big picture, our efforts here at Mass and Cass have been driven by a public health and housing-led approach. The encampments that we see and that some individuals have been living in for a number of years at this point are not a safe or healthy place for anyone to be living. There's no heat, no running water, poor sanitation. We've seen a number of fires because folks are trying to stay a little bit warm with propane tanks. We have seen ongoing issues around frostbite and hypothermia as the temperatures drop. And so we're really approaching past the point of urgency here. Tomorrow, we will see even more urgency as temperatures continue to drop. What we are putting forth is, and what we have been implementing, is a new approach, a truly individualized approach based on meeting each person where they are and identifying the specific health and housing needs of each resident at the encampments, working with them day in and day out. In December, the Boston Public Health Commission surveyed those living in the area, identifying 145 people who were living there between the dates of the survey, December 6th and December 8th. Almost all individuals who were surveyed then stated that they'd like to move into low-threshold housing, but that many of the existing shelter options were not meeting their needs. We also spoke with individuals about their medical and health conditions, about their journey to recovery, and truly established that for the vast majority of people there, nearly every single person living in the encampments, the right solution, the ideal dream, was to find low-threshold supportive housing wrapped around with medical services. We've seen efforts in the past where tents had been cleared but then reemerged elsewhere. And this happens when we fall short in terms of connecting people to appropriate housing and services. Since then, up until now, there have not only been ongoing efforts to connect people into that low-threshold supportive housing which has been created, but daily meetings coordinating across our agencies and service providers, running through the list person by person based on relationship building, based on those ongoing daily conversations that are happening right on the street. And so these efforts don't just start this week. I very much want to express all of our gratitude to the many city and community organizations that have been involved. I especially want to highlight Boston Public Health Commission's outreach teams, who have been on the ground for years, working with residents at the encampments and truly building relationships to meet people where they are. After the survey was done, on December 16th, city staff notified people living in the encampments that tents would not be permitted in the area after January 12th. and that the city's outreach teams would provide all individuals with information about shelter, housing, and treatment resources. We continue to make progress on this goal, and as of this morning, 83 people have already been placed into housing created across the city, and there is space available for the remaining 62 residents of the encampments who were surveyed. Daily wellness checks continue to happen, especially as the temperatures have grown colder, and we continue to see people moving in every single day into the new housing that's been created. So this week marks a transition from a housing surge to community building and recovery. On Wednesday, the city will continue efforts to connect individuals with housing, take down the tents that are left behind and no longer needed, and begin clearing the street. City departments will continue to maintain their presence in the neighborhood beyond Wednesday and beyond this week as well. The Boston Public Health Commission will continue delivering critical health services. The Public Works Department will focus on investing in street repairs and regular cleanings to bring that area of the city back into repair. The Boston Police Department will ensure a safe environment for residents, businesses, and individuals accessing care. I want to note that the efforts to remove the encampments, some of which are very large fortified structures, will take more than one day, but these efforts begin in earnest on Wednesday. We are also working to deliver a medium and long-term plan. Last week, members of this team, standing behind me, visited Long Island. This is part of a comprehensive audit of all city-owned property and land to identify opportunities for permanent and supportive housing. We need, as these efforts go on, we need regional investment, collaboration, and action, and we will continue moving in consultation and coordination with the state and other municipalities. Brevemente en español, quiero compartir nuestros planes para aliviar la crisis humanitaria más en casa. Nuestros esfuerzos han sido impulsados por un enfoque centrado en la salud pública y la vivienda. El campamento es un grave riesgo para la salud y la seguridad pública. No hay calefacción o agua corriente. Hay más urgencia por el frío que viene y que está aquí. Esto es un nuevo enfoque, diferente al anterior. Hemos hablado individualmente con la gente en el área para identificar sus necesidades médicas y de vivienda. En diciembre identificamos a 145 individuos que estaban viviendo en la área. Antes, los campamentos se desalojaban sin conectar a los residentes con vivienda adecuada. Hoy tenemos reuniones diarias con varios departamentos en la ciudad para coordinar recursos. A partir de esta mañana, 83 personas ya han sido ubicadas en viviendas y hay espacio disponible para las otras 62 personas que participaron en nuestra encuesta. Los esfuerzos continúan. No empezamos esta semana. Los equipos de la Comisión de Salud Pública han estado en el área por años. Estoy muy agradecida de todos los empleados municipales que han estado trabajando en aliviar esta crisis. Esta semana marca una transición. El miércoles, la ciudad continuará con los esfuerzos para poner en contacto a las personas con recursos de vivienda. Retirar las tiendas de campaña abandonadas y comenzar a despejar la calle. Nuestros departamentos mantendrán una presencia en el área durante el proceso mientras finalizamos nuestros planes de medio y largo plazo. Gracias a la disponibilidad de nuevos recursos y servicios, estamos creando un espacio para que las personas que recuperen, sanen y estén seguras. Ante la crisis, nuestro enfoque se basa sobre todo en la salud pública. Okay, now I would like to hand it over to Dr. Monica Burrell, our senior advisor.
Thank you, Mayor Wu. Good morning, everyone. Thank you for being here today. As you've heard the mayor speak about, we are addressing this humanitarian crisis with a public health, equity-focused approach. Since December 15th, we have worked intensively to inform the individuals staying in the encampment of viable, low-threshold housing and shelter options that are available to them. We have worked every day, 7 days a week, with outreach individuals, talking to the individuals staying at the encampments, doing wellness checks. And last Wednesday, we did post notice to give them further information of what will happen on January 12th. Our teams are there again this morning, talking to individuals, doing outreach. We've placed, out of the 145 individuals, 83 individuals as of this morning, and there is space for the remaining 62 as well. All individuals staying at the encampment will be offered a safe indoor space to go. We all know that the conditions are very unsafe in the encampment. In the last week, with the temperatures plunging and the snow, we have worried about hypothermia, frostbite, and other cold-related injuries as well. We have a coordinated team and plan to intensify between Monday, Tuesday, and Wednesday our ongoing outreach efforts. We have more people on the ground this morning as of 6 a.m. We are coordinated across our many partners who are doing this work. We are coordinated among our departments at the city level. We meet daily at the city level. We meet daily with our providers who are assisting us with the placement and the medical care and the mental health and addiction needs of the individuals staying at the encampments. Today, tomorrow, and Wednesday, there will be more individuals. It will be a coordinated effort between all of us. And most importantly, the individuals who we are helping are a fragile population. They're individuals who require us to stay nimble. Conditions change, and we will be flexible and nimble as we go through the next few days to ensure that we get individuals out of these cold, unsafe conditions. And as the mayor mentioned, this is the beginning of our process. Addressing this humanitarian crisis was step one as we work towards our medium and long-term goal of improving the way that we all together think about how we address homelessness, addiction, mental health issues going into the future. Thank you. I'll pass it over to Chief Dillon.
Thank you, Dr. Burrell. Just want to give a couple of comments on our housing efforts. As was mentioned, the city has been working with the state and many of our nonprofit partners to bring on a low-threshold housing and shelter space to those now living in the Mascass area. To date, spaces for 200 individuals have been identified, and 159 of those spaces are now operational as of this morning. Those spaces, as been mentioned, are providing decent, warm, and safe housing, but also every program that has been brought on has 24-hour staffing to ensure that the residents are safe and receiving the services that they need. I do want to take a brief moment and just thank our partners, the Boston Public Health Commission, Victory Programs, St. Francis House, Pine Street, and Boston Medical Center are all operating these programs, and they put them forth in very short time and under some difficult conditions with staffing. In addition, as the individuals that are now living in Mascass go into these transitional spaces, they will be given the supports and the housing search workers to help them get into treatment and permanent supportive housing. So that work will start as soon as they're stabilized. And finally, it's been mentioned several times this morning that we do indeed want to put forth a midterm and a long-term plan for the population that needs both recovery and housing, and that will include inventorying what exists, what programs need to be improved, and what the gaps in those services are and what we need to develop. So with that, I'm going to hand it over to Dr. Am I going to? Yes. Okay. Ojikutu. Thank you.
Thanks everyone for coming, and good morning. So as mentioned by my colleagues, we're taking a comprehensive public health approach to this issue. At the Boston Public Health Commission, our city's health department, our dedicated staff, along with our partners, work every day to prevent overdoses, implement harm reduction strategies, connect people with medical care, prevent HIV outbreaks, link people to substance use treatment, and refer them into our city shelters, including 112 and Woods Mullen. This will not end on January 12th. The need for these services will continue and will be great even when the tents in this one area are gone. I think that this is important for us to recognize that this is a very complicated issue. I know many people have said this before, but the confluence of substance use, homelessness, and mental health disorders is very difficult to tackle. And the fact that we are starting here is just, it's one step. It's one step in the right direction. I also want to emphasize that this approach is different. It's different from what's been done before. Obviously, we're increasing access to a scarce resource, that's low-threshold housing, and that's been a cornerstone of our approach. But we're also intentionally focusing in on health equity. From the very beginning of this process, the Commission collected data on the demographics and needs of the encampment population. We know that we're dealing with an incredibly diverse population. More than 64% are people of color, 14% speak Spanish as their primary language, and we know that access to services for substance use and mental health disorders differ in this country by race and ethnicity. And in order to provide equitable access, we're reviewing these data on a daily basis to make sure that we're providing services to everyone who needs them. Secondly, I think this effort is also different because we're acknowledging up front, right here, that this is one step, and albeit a very important first step, but it's the first step in a much longer process of addressing these issues. Failure of many systems, our healthcare system, our mental health system, our criminal justice system, that's what has led to these encampments, and these issues are not going to be fixed by Wednesday. So we're working hard now, and the work has just begun, and we have a lot more work to do to address these issues in Boston. So thank you, and I look forward to providing updates in the near future.
While everyone's here, I will also just reiterate, I know this announcement is going out from Boston Public Schools as well, but schools will be closed tomorrow because of the frigid temperatures. También quiero anunciar que debido al frío, las escuelas estarán cerradas mañana. Okay, questions? Sure, and I'll bring up Chief Dillon to get into, I don't know if Dr. Arjikuta wants to weigh in as well. The housing surge that has come together has been just a remarkable coordination between so many city leaders as well as community organizations and service providers. So there are a number of sites across the city. As you had heard, several of them have come online just as recently as this last week and into this week. There are multiple sites at the Shattuck campus, residents at the Envision Hotel in Mission Hill, and beds and residents at the Roundhouse in that area, as well as some of the shelters that have now been transitioned into low threshold beds instead of higher barrier beds. Chief Dillon, what did I miss?
That is correct. As of today, we have people, as the mayor mentioned, in the Envision Hotel, at the reimagined and repurposed shelter space at 112 and Woods Mullen. There are folks at the cottages at Shattuck. Some of those have been, we have some of the cottages are going to open next week because of electricity delays. Roundhouse has started taking guests. And today, Pine Street out at Shattuck will be welcoming individuals as well.
In terms of the number of people, okay, so I'm told to repeat the questions because no one can hear out there. So the question was, how many people are remaining at Mass and Cass today, and what about temperatures and the cottages? There are, as mentioned, 62 people of the individuals that we had surveyed in December and have been working daily with and building relationships around their specific medical, health, and housing needs. 62 individuals remaining on that list, all of whom will be able to move into housing that we have created and identified and staffed. There are more than those 62 people at mass and cast, however. It's a situation in flux. People are kind of constantly coming and going, but in addressing this crisis and the situation that's in front of us, our approach is to really understand who is truly living in the encampments and has been living in this area for some individuals for a number of years, who we are going to connect and really wrap around with housing and services, and then continue outreach with any other folks who might be in the area or in need of housing and shelter, as has been the city's mode for even long before this approach, to ensure that we're still connecting everyone with resources in addition. And then on the cottages.
So each cottage has its own heating unit, so they're run by electricity, so they're individually heated.
People are in them now, or they will be moving? If you can kind of detail where that project's at.
Sure. There are 10 cottages right now that are they're smaller and they're occupied by individuals. There's another five they're not occupied yet. They're larger and they're suitable for couples. Those we anticipate coming on next week. They had delays because of electrical trench.
Mayor, in Spanish about the situation remaining kind of what you said. Thank you.
Nuestro objetivo es crear vivienda y servicios para cada persona que viven en la área de Mass and Cass. En este momento hay 62 personas que también todavía necesitan la conexión a la vivienda, pero estoy muy confianza con la disponibilidad y oportunidad de proveer esta vivienda.
¿Usted apoyaría regresar a la modalidad remota si siguen los casos de COVID-19 aumentando?
En este momento, la pregunta es sobre la provisión de educación remota en las escuelas públicas. En este momento no es posible de contar el días de educación remota porque la policía del gobierno del estado, pero hemos en conversación con el gobierno, el gobernador y otras oficiales estatal para la flexibilidad que necesita nuestro distrito, que es diferente de otros distritos de escuelas públicas en Massachusetts, pero para el mañana no estaba un día de educación remota. Yes. Our approach has been a public health and housing-led approach. We have worked with the individuals living in the encampments for days, weeks, months, hour by hour at this point. So our Boston Public Health teams know these residents of the encampments very well and are working with each person. We are going to focus on connecting people to the housing and services that they need, and will not be we are looking to avoid criminalizing any part of this process. There has been activity going on that is not safe, that is not in the best interest or health or legal when it comes to drug trafficking, when it comes to violence that we have seen in that area as well. So in terms of housing individuals, we will stay focused on housing and public health, but Boston Police will continue to provide support in ensuring that it's a safe environment for all. Dr. Jakuti, do you want to add anything on this front? Okay. Over the weekend, when the snow, or was it Friday? On Friday, when the snow was coming down, our teams were out there working urgently with people to make sure that everyone could get out of tents, and where they were shoveling snow and really trying to provide that safety for everyone there. But it is impossible to be fully safe and healthy living in a tent in winter in Boston. And so we cannot wait even one more day, one more week to make sure that we're connecting people to housing. I'm just so grateful to this team that has worked for so many days to create the appropriate housing that is fully staffed, connected with supports and resources, and our community partners have been a godsend in terms of really stepping up and making sure that we will be able to connect people in this week.
Dr. Burrell?
Do you mean for the cold, Yawu, or just in general front staffing for COVID? Okay, yep. So the question was, what have the communications been like with Commissioner Riley and the governor? Our teams are in constant contact, and I'm in frequent communication with the governor as well about Boston's situation. We are the largest district, and we have a very significant community positivity rate right now that affects our staffing and workforce across every single department. And so tomorrow will be a closure because of weather and frigid temperatures. We do not anticipate a district-wide closure at this point. Our goal of really making sure that families have supports, students continue to have high-quality education, food access, everything that schools represent remains the number one goal. And so closures are truly a last resort. We do know that COVID positivity has been very much impacting our workforce and our educators and school staff. And so we'll continue to monitor the situation school by school. But at this point, don't anticipate district-wide closure. Our number one goal is to make sure that every single community member, our students, our educators, our school staff, are safe in school. We have, and I'll invite Dr. Ojikutu up to add more if she's interested, we have been meeting every single day on measures to prioritize public health and COVID safety, especially in the midst of a surge. So students and educators are receiving high-quality masks. We are tightening up our policies when it comes to returning from after a positive test, the procedures after that, and we'll continue to work with each school leader on a school-by-school basis to put in place the protections that are needed. But our schools, again, aside from tomorrow's cold, are expected to remain open at a district level, and we're working to make sure that closures would be a last resort because of the impact on so many families. Yeah, I've run into, the other day I was taking the T in to work and had run into a student from Boston Latin on her way home from school at the Orange Line, and she was saying that because of the staffing situation and because of the pandemic, she was headed home with her parents' permission, just worried about her own safety and her own health. We are in a very difficult time. We're in a very stressful time all around, and I know this is weighing so heavily on our school communities, especially our young people. And so I thank our students for their activism, for reaching out, and for making sure that they're highlighting the issues of safety and what's needed in our schools. We'll continue working to make sure that we're doing every possible thing to keep people safe in the city. The best tool that we have is to continue boosting vaccination rates and booster rates. What Boston's been doing has been working. We've been seeing those numbers go up in terms of the proportion of residents who are vaccinated across our communities. Over the weekend, there was another clinic at Madison Park where we saw over 350 people vaccinated just on that one day. And so we'll continue hosting those in the community. That is the way, that is how we end the pandemic.
So as Mayor Wu mentioned, we're in a very difficult time right now. Our community positivity rate is 32%. Our hospitalizations have gone up about 50% in the last week. Our emergency department visits have also gone up about 30% in the last week. We're seeing more than 2,200 cases per day. In this circumstance, obviously, we're very concerned about all members of our community. Certainly very concerned about our teachers, our staff at BPS, and our students. Right now, as Mayor Wu mentioned, there is no plan to close schools. However, what we've done to ensure or to decrease the risk of onward transmission, we've put in recommendations for strategies that I think are quite important. That includes increasing the number of times that we're actually doing surveillance testing in the schools, and certainly, enforcing isolation practices for people who are positive. Requiring that people have a negative rapid antigen test if they are positive when they're returning to school is obviously very important. We've put in some new recommendations in regards to PPE, so masking in particular, to provide surgical masks as well as higher grade KN95 masks to our teachers and our staff, which is incredibly important given the high transmissibility of the Omicron variant. And then, as Mayor Wu emphasized, we need to get people vaccinated and boosted. Our rate of vaccination amongst ages 5 to 11 is about 37% across the city. We have enormous disparities where we have Black children 5 to 11, 18% vaccinated, 23% amongst Latinx children. This is a problem. And then in terms of boosting, as a city, we're 41% boosted. And if you compare that to other jurisdictions around the country, sure, we're doing okay, but we can do better than that. And that's what we're trying to do. We've set up clinics at the schools for kids to get vaccinated, for their parents to get vaccinated, for their grandparents, parents to get boosted, and for the public to also have opportunities for that access to that service while they're there. So I think we're putting the right strategies in place, but we do realize that being in school is important for the social, emotional, and educational well-being of our students. So that's our plan right now, but we're touching base every single day with BPS and working very closely with them as well as with Mayor Wu's office. Thank you. Right, so I think that's an incredibly important question. So we're discussing this with the state. We're discussing doing increased surveillance testing in the schools right now. We'll certainly work very closely with them. So this is actually supported by the state, but of course, the city is contributing, and we're working as a partnership in this regard. No, that's not what I'm saying. What I'm saying is that we're changing our strategy in terms of testing so that we're doing more, we're recommending to do more surveillance testing in light of this surge. I think one of the problems with some of the strategies that, we have been using is that they're resource intense. I think that there's a lot of resource that goes into doing, test and stay effectively, doing contact tracing, all of which is important, incredibly important. But we have to realize that with a community positivity rate of 32%, we also are looking at a lot of cases and a lot of resources and a lot of staff who are out because they're sick with COVID. So keeping all of that in mind, we're trying to put the right mitigation strategies in place to keep schools as safe as possible.
Can I just add one thing to Yawu's question, and I'll come back, Erin. We would always welcome more support from the state in ramping up frequency of testing. This is going to be a need, not just within our school system, but across the general population, even beyond the surge. And just to give a little insight into some of the conversations that we've been having with the state about what might work for other districts, but what doesn't quite work for Boston. The state's program requires an active opt-in for every single student to be part of their mode of weekly testing and participation. In a district like Boston, where we are working, and I know Superintendent Caselius and her team have used every mechanism of outreach, text messages and calls and direct outreach, There are some portion of students who have opted in. There are some portion of students, a much smaller portion, that have opted out, but there is a huge proportion of students who we have not been able to hear back from one way or the other. And so some other districts have opted out, that's a bad word. Some other districts have chosen not to participate in the state's program because they would rather use an opt-out as a default rather than needing to have an opt-in. So we're exploring what that means. Sorry.
Last week we saw over 1,000 teachers and school staff members out on COVID illness, and 1,000 students. What are those numbers looking like this week? And how important is it that the school launch a little bit on its approach to remote learning to allow them to have Sunday out here or another day this week? What's it?
I don't have the latest numbers as of today, but I'm sure we can get them quickly to you. In terms of the importance of remote learning and flexibility, Boston is going to make it work, and we are going to provide a high quality, safe, supported learning environment for our students, no matter what policies we are facing from the state and federal government. It would be helpful, given that we are such a large district, given that we are always disproportionately hit by the impacts of the pandemic in our population of students, in the communities that our families are living in. Whether or not we get credit from the state for a day of remote learning, if a school needs to, and a school-by-school basis needs to do that because of staffing issues, we are going to take that if that's the safest way to administer learning that day. It just means that we would have to make up days at the end of the year. Each district has a certain number of snow days already allocated, and so we've taken one for snow last Friday. We are taking one tomorrow for cold. I think there's something like 5, don't quote me on this, we'll get the exact number. It's something like 5 total snow days already baked into the calendar before we would have to add days to the end of the year. But because, again, these are not, this is all hypothetical at this point because we have not yet had to move there. But if staffing challenges persist at certain schools, and we would need to do this at a school-by-school basis, many of these schools are already preparing to offer remote learning, whether or not it gets counted by the state. And so, again, for Boston to have maximum flexibility in administering what is safest for our students that still provides a high-quality learning experience, we would always appreciate that flexibility.
Last time Boston Public Schools closed because of cold weather, and then can you further elaborate why the decisions being made today?
I don't know off the top of my head, certainly not in our tenure in the last, I don't know what day we're on now, 50, 60 some days. Tomorrow, temperatures are expected to be quite cold with the wind chill, and so just to prioritize the safety of our students, and especially given the staffing issues that we are seeing in schools and with our school bus drivers as well, we want to make sure there's no risk of students being either out in the cold on the way to school or having issues in school because the ventilation that's needed with the pandemic and more windows being open throughout each of our school buildings. I'm told that there is an internal affairs investigation pending in this case, but I don't have any further details.
Sounds like you have the housing for them and you've offered it to them. For people who don't understand why someone would take the housing and get out of the cold, just briefly explain what's going on with that.
Sure. Okay, so the question, and I'm going to invite our 3 chiefs up to answer. The question was, we have 60-some people who still need to be connected to housing. The housing is there. It has been created. It's available. Why would someone not want to go in?
Thank you for the question. So there are 62 individuals from that 145 tent list who are left. So one of the most important reasons that they haven't yet gone into that housing or low threshold shelter spaces because it wasn't yet open. So as a reminder, on Friday is when Roundhouse opened up. The Pine Street Inn, 30 spaces that have opened up now at the Shattuck opened up today. So that's one reason, is as you know, our spaces hadn't yet been available. A couple of the places that had to hold admissions, for example, last week due to COVID and staff shortages. So some of it is related to availability of the beds. Another reason is because this is a fragile population who can be transient. So at times they're not in the spaces or the tent that they said they were, but that's why the daily outreach has been really important to find them and help them find these spaces.
I think I want to add, and I know I've used this word, probably overused it, is that this is complicated. You're talking about a situation where people have, in a sense, created a community. You know, this is an encampment, and people live there, and they take care of one another. And some of this is about moving people away from what they know into something unknown. And I think that that's important for us to recognize, because that's why it's so critical to have our outreach workers not only providing, we do with the referral, we do the orientation to the new sites, we do a lot of hand-holding to get people where they're going to go, and we plan to follow up afterwards, because we want people to stay. We don't want people to migrate back into the area. So again, I think this is a process. We're doing the best that we can. I think there's been an enormous amount of effort across city departments to mobilize this effort, but I do think that this is difficult. And I would also emphasize what Dr. Burrell said, that this population is fragile. I mean, we're talking about people with mental health issues who are dealing with substance use disorder, and we're really trying to take a very public health oriented medical approach to this and understand that people are dealing with a chronic illness. They have to have continuous linkage to services, and that will be a challenge moving forward, and we'll be following this very closely.
And thanks to all the teams who are watching and chasing down information in real time. So just to report back, the last time that schools were closed for cold was January 7th, 2015. And as of today, we have 1,202 staff absences at Boston Public Schools. Again, not all teachers and also not all for COVID-19, but that's the total number today. Not at this moment, sorry. We'll try to chase it down. January 7th, 2015. 1202. Yes, across all school staff.
Are you considering tents at testing sites? Does this come up at all? Something in your
For the lines?
Yeah.
We are. So yesterday I went and stopped by the first day of extended hours at the Anacole Community Center testing site. This has been one of our busiest sites across the city, and a place where even I think early last week or a couple weeks ago we had seen a 3+ hour line outside in the winter. And so thank you so much to Dr. Ojakutu's team, to our operations team, to Chief Dempsey and the fire department. So many people acted very quickly, and there's now, if you walk into that space, the outdoor line, there's a tent set up along the length of it for people to wait. It is heated and ventilated, and so there's heating that comes in, and then at the top of each sort of panel where it connects to the top of the tent, there's a gap for airflow as well as open panels along the length of it. The staff inside the testing site told me that given the extended hours, the lines were already much shorter, but now again, if people are having to wait in line, there will be a heated line on top of that. Dr. Chikutu, are we doing that elsewhere too?
So, the tents, I think that was a great suggestion in addition to Anacole. I think that's temporary though, right? Because the goal is to have more access to testing sites. So we're opening up additional sites, and like I said, we're like Mayor Wu said, increasing hours at the site so that people don't have to wait in line as long at all. And I think that's really the longer term solution to this. As we know more about exactly where the sites are, this will be made available to you this week, and it will be available on boston.gov, but that is definitely a high priority.
Okay. All right, thank you everyone.